I'm joined now by Dr. Thomas Weber of Sentara RMH Orthopedics and Sports Medicine, and he's going to tell us, first of all, what is sports medicine?
So thanks for having me today, Bob. Sports medicine is a term that encompasses all the medical issues that athletes and some non-athletes can experience. And so we not only take care of their musculoskeletal problems like sprains, strains, fractures, etc. We deal with some of the medical issues that athletes can have. For example, exercise-induced asthma and diabetics that like to exercise. We deal with not only, again, the structural issues, but some of the metabolic problems that athletes can incur.
Is sports medicine only for athletes?
It's not. It's not. People of all ages, whether they consider themselves athletes or not, as long as they're active, we're happy to help them, whether it's getting in shape for a training program or if they sprain their ankle stepping off a curb, while they're walking through Court Square. Any types of those folks we can help at our orthopedic center.
Okay. What is a concussion?
So a concussion essentially is a brain sprain. The brain is about 6 pounds and sits inside your skull, which of course is a rigid structure. So any injury or activity that causes that brain to shake inside the skull can cause damage to the brain. The neurons and some of the synapses and cell structures get damaged, and then that leads to symptoms of headache and fatigue and confusion, sometimes blurry vision, sometimes dizziness. It's received a lot of attention lately.
Mm-hmm. So why are we, speaking of that, why are we hearing so much about concussions and brain injuries in the news?
Interestingly, these problems with concussions have been around forever. Back in the early 1900s, they talked about punch drunk when they described boxers that had these chronic problems. And now, more recently, it's primarily been highlighted by the NFL players like Junior Seau that have taken their own lives. We're realizing that these chronic and multiple concussions in athletes and non-athletes over time can lead to brain disease.
Okay, so it's become much more important to focus on it and not just kind of blow it off like, oh, he had his bell rung. I mean, there's protocols now, I guess at all levels of sports to try to address this, because I guess the big problem comes where it might be repetitive and you don't give the brain time to heal?
That's correct. We're much more careful and cautious about keeping those athletes out of play, and sometimes our student athletes out of school, because all of that brain stimulus is hard on the brain, delays recovery, and that's correct. Cumulative effect of all these brain injuries can lead to something called CTE, which stands for chronic traumatic encephalopathy.
Okay. Dr. Thomas Weber of Sentara RMH Orthopedics and Sports Medicine, thanks for being here.
Thanks for having me.